Hey everybody, welcome back to the show. Can't wait to get into today's episode, and it is on going beyond basic cholesterol. One thing that I like to look at in my practice, especially with private clients, is not just the basic numbers that you get from your PCP or conventional medicine on your annual blood work. All of that is fine, but it's really so basic, and it's not going to tell you how to personalize a nutrition plan, a diet plan, an exercise plan, a nutritional supplement plan, a sleep plan. There's almost nothing on it that is actionable unless you're out of range. And then, of course, as we've talked about before, that means that rain barrel has been overflowing or at least filling up for a while, and now you've got the first stages of dis-ease in the body. Remember, everything for the most part can be reversed except for terminal-based illnesses. And so the nice thing is most people will be able to listen to a show like this and be able to take the steps to reverse it. What I want to do is, again, always give you the same care I give in my clinical-based practice, and I want to share with you the advanced heart and metabolic lab panels that everyone should know about that we run in our practice. Many years ago, I did a show on your basic blood work that everybody should run. Today, I'm going to go over advanced cholesterol that go beyond the typical lipid panel. They call it a lipid panel when you run this with your doctor. And the lipid panel is typically total cholesterol, LDL cholesterol, right? We'll talk about that in just a moment. HDL cholesterol. They might give you a total cholesterol to HDL ratio, which you probably heard me on previous shows say, get it below a 3-to-1, and then your triglycerides. That's the whole panel they give you. Well, there's so much more to it. And honestly, those numbers are just the very bare basics, and they're not going to give you a good insight into future heart disease risk that we were talking about last year as well with those predictive calculators. All right, so let's dive in. And I want to start with the most important number really that you could run. And more people are talking about this, which is amazing. So we're going to start to see more and more people finding out their number. But this is your apolipoprotein B. On lab work, it's just called APO, that's APO, and then B. That's it. Why? This is the most predictive marker of heart disease risk. So let's just say you didn't run any other marker except this one. Probably the best thing you could run, honestly, the best thing you could run. And the reason is that this measures the total number of atherogenic particles. That means particles that can cause plaque buildup, calcium buildup, inflammation in the arteries. And those consist of your low density lipoprotein, LDL, your very low density lipoprotein, VLDL, your IDL, and your lipoprotein A, and we'll talk about those all in just a moment. So it's basically measuring all of those together, and it's a much stronger predictor than LDL, which is considered bad cholesterol. It's basically oxidized cholesterol, all right? So the goal for you, I'm going to give you a goal for you. The goal for everybody is to get it below 80 milligrams per deciliter, okay? That's the goal for apolipoprotein B, or just ApoB, all right? The next one is LDL. So LDL particle number, one that goes a little bit deeper than just your regular LDL. It's talking about how many LDL particles are circulating, not just the cholesterol they carry. So it looks at more small, dense LDLs, which could be a higher risk. The goal is to get these under 1,000 nmol per liter. That is the goal. So when we look at this with clients, although it's one that not every client decides to run, this gives us a little better indicator of what are those when you have LDL. Let's just say you have LDL of 130, right? And most doctors want to get your LDL, let's say, below 100. So if you have 130, we want to say, okay, well, what does the particle number look like? And then we'll talk about particle size in just a moment, because all of those matter. The smaller, the worse, right? The smaller particles, the worse. And then the greater the number, the worse as well. All right, the next one is lipoprotein little a. This is one that we definitely run in our practice. And truthfully, it's like genetics. You only really need to run it once, although I'm going to add a caveat to that because let me tell you what it is first. So this is essentially a genetically inherited particle. It's not necessarily greatly influenced by a lot of diet and exercise, but there are caveats to that. I'm going to share that in just a moment. But higher levels 3x your risk for heart disease. So meaning you want a lower number. Yes, this part is actually genetic, but the goal is run it at least once. If it's below 30 milligrams per deciliter, then you're doing well. So that's a great thing to see. Lower the number, the better. So that's what I look for in the labs. Now, I did say that it is genetically inherited. However, I've seen it influenced. I have seen it go down, typically with good omega-3 use, 2 to 3 grams a day, and a few other nutraceutical interventions that I'll do a whole show on. So if you have high lipoprotein little a just means literally it's not a capital A, then I will do a show on that too and teach you how to lower that through the best of science. And then, but if you're doing those things right, you're also influencing all of your other negative forms or oxidized forms of cholesterol that can cause heart attacks or heart disease. All right, the next one's oxidized cholesterol. This is damaged or inflamed your LDL particles are. The more oxidized, the worse for you. And this is the number that we're going to look at on most labs. And this is a number that you typically want below 100 to 110, but the number does not matter as much as what we just spoke about before, lipoprotein little a, and then especially apolipoprotein B. And we'll talk about VLDL in just a moment. That's the type of LDLs. All right. One that I would be remiss if I didn't talk about, that is HSCRP. CRP stands for C-reactive protein. The HS is a new one. I mean, it's a decade old now, but not every doctor runs it. It's the high sensitivity CRP. And so this is a marker of systemic inflammation. You will see it go up with a bacterial infection, a viral infection, many autoimmune diseases. It means there's a lot of inflammation in the body. In my practice, I want it below a 0.5. I want it low, okay? So that's milligrams per liter. Under 1 though, 1 milligram per liter, you're still doing well. So if it's a 0.7, okay, yeah, you're doing well, but the lower the better. And why am I bringing this up when it's not cholesterol? It's not a lipid, it's not a fat. Here's why. Heart attacks, 50%, actually it's more than 50% of people who have a heart attack have normal cholesterol. And then the other 50 have abnormal cholesterol. So having a heart attack has way more to do with your cholesterol than your cholesterol numbers. And inflammation and stress are as big a factor. And CRP shows that systemic inflammation. Okay? So of course, look at the root cause, work on the root cause. Homocysteine, another big one. What is this? It's essentially endothelial damage or inflammation. So it's inflammation of your arteries. That's the biggest one. And it's usually linked to poor methylation patterns. So in our practice, we use trimethylglycine, which is TMG, also called betaine anhydrous. It's B6, B12, and B9, which is folate, and it's the methylated forms. So methylfolate, methylcobalamin, paradoxal 5-phosphate for B6, and then TMG, trimethylglycine. So those work really well. We don't megadose. We just use the dosage large enough in order to be able to get a clinical result. So it's typically 1.5 to 2 grams of TMG total per day. And then we'll go somewhere around 800 to 1,000 micrograms, sometimes more only if needed, of methylfolate. We increase the B12 quite a bit. So the daily nutritional support has this, the activated B complex has those, and then B6 will typically use at 50 milligrams, maybe a little higher if we need to. So that's that. And that one usually is very fixable. And the ideal is between 6.5 and 8.5 for most people. You know, you don't want it too low, you don't want it too high. So 6.5 to 8.5 for most people is pretty great. All right. Insulin levels. Again, not a cholesterol number, but absolutely imperative to keep it balanced in order to not spike inflammation in the arteries. That's another big one. So you want to create insulin resistance. You don't want to create a environment in your body for metabolic syndrome, high blood pressure, high cholesterol, type 2 diabetes. So what we look at is a fasting insulin level between a 2 and a 6. Functional medicine will usually say up to an 8 is okay. And I think that that's probably okay. We like it between a 4 and a 6. That's typically where we see it. 2 to 6 is usually our range. All right, let's go over triglycerides. Triglycerides, fats essentially mobilized by the liver. Do we look at this? We absolutely do. So for triglycerides in our practice, we want them at about a 50 to a 75. Okay, that's the sweet spot for us in our practice. We're happy with anything below 100. But we want it between a 50 and 75 in our practice. Then you can start to get into some more interesting ratios. You probably, again, you run your HDL before, you know, you want that above a 59. So you don't want it super high because it can actually mean that there might be a lot of oxidative stress in the body. And that's why your body's producing so much of this so-called good cholesterol. And I'm putting that in air quotes. So When we look at high density lipoproteins, that's what HDL stands for. Yes, we want a good amount of it, but we want it enough to be, let's just say your cholesterol is 180 and your HDL is 60. That's a 3-to-1 ratio. Beautiful place to be, right? Because it's hard if you have cholesterol of 180 and an HDL of 60 for other numbers to be off. Let's be honest. These advanced ones are for people with heart disease in their family, or their numbers have been a little bit off, or they just want to kind of test once and for all. And like, I think it's great to be able to test. I'll share with you, Quest can run these numbers for you, Cleveland Heart Clinic, Boston Lab Clinic, all of these, and your PCP could run these numbers if you ask. There's no doubt about it. So we'll list them today. If you want to list, head on over to stephencabral.com/3450, and I'll actually just list all these for you. You can take them to your doctor if you'd like. Okay, so let's get back to that. Cholesterol to HDL ratio, even if the lab doesn't give it to you, just divide your HDL into your total cholesterol. Look for a 3-to-1. All right, or less potentially. Your triglycerides, this is another one. Triglyceride to HDL ratio. So you want it below a 2-to-1. So when you look at this, let's say someone had a HDL of 50 and triglycerides of 150. That would be a 3-to-1. That would be bad, right? But let's say they had HDL at 50. That's not ideal. That's not above the 59. But they had triglycerides of 100. Well, they're right at that borderline, right? Like, we know that that's not optimal, but okay, but it's okay. Now, let's say they had HDL of 60 and triglycerides of 75. Well, they're way under, right? Like, you really want that closer to that 1-to-1. If you had HDL of 75 and you had triglycerides of 75, that's pretty great for heart health. I mean, it really is. So it's a nice one to shoot for, the 1-to-1 there, and then total cholesterol to HDL about a 3-to-1. All right, so I want to get to just a few of the more cholesterol markers that you may never run, but they're nice to haves. So the first ones that I gave you as a list, I would love you to run, right? Even at least once, the lipoprotein little a. But let's go over them now. So there's another couple that I want to give you, and that's VLDL. You may have seen it. You may have heard of it. It's just simply your LDL that you've already run, but now it's very low density lipoproteins. So these are the more dangerous form of LDL. So again, let's just say you do have an LDL of 130 and you want to say like, okay, are these the lighter, fluffier particles for LDLs? That would be better. Or are they the very low density lipoproteins that can sink down and then create more oxidative damage in your arteries? We don't want that, all right? So these are far more dangerous, and certainly a red flag if they are out of range. So different ranges, different labs will give you different ranges. It will denote where you are on that range. And of course, we want to be lower the better for VLDL. All right, the next one is one that is not as common, but again, I think you should know about it. It's called small LDLP. The P stands for particles, so it's small and dense particles. We just kind of talked about the VLDL. Well, it's a look at that, but these are those same VLDLs, okay, same LDLs that can penetrate the endothelial tissue or the wall or the artery wall. So they literally can embed themselves, it can penetrate it, creating high levels of inflammation, and then could cause calcium buildup, could cause plaque buildup, cholesterol buildup in the arteries, right? So the more that gets embedded, the more inflammation, and the more the body needs to come in and repair with cholesterol and potentially other minerals like calcium as well. All right, if you are concerned about your HDL number, it's just not high enough, you think, you can run what's called the HDLP. P typically stands for particle or particle number. This is how many HDL particles you have, not just the HDL cholesterol itself. So high HDL-C, which is your cholesterol, doesn't matter if your particle levels are low. So you might say like, okay, well, I feel protected because I have high HDL cholesterol. Okay, but if your HDL-P is low, not so great. Or you're like, I'm borderline HDL. I'm borderline HDL for good cholesterol. Maybe you're a 56 or 55, right? You run this and you find you have more larger and numerous HDL particles. That's a good thing. That's more protective. All right, let's do one more. That is VLDL particle number. And this just takes your VLDLs that I just spoke about, which kind of all this last part is about that. And it tells you the size and number of VLDL particles. Remember, the more you have, the more dangerous. The smaller and more dense, the more dangerous. They can penetrate that arterial wall, cause massive inflammation, which could lead to heart disease, heart attacks, etc. It also may signal poor triglyceride clearance, because VLDLs work in unison with triglycerides. Basically, before it becomes, I don't want to get too deep down the rabbit hole. We can go down the rabbit hole if you want. Just let me know in the comments. But basically, before it becomes an LDL particle, it's a VLDL particle. It's essentially manufactured from the triglycerides that are bound to it coming from the liver, and then some of those get dropped and they become an LDL. Again, I don't want to, it starts to go way down the rabbit hole in terms of biochemistry, which I love, but for our purposes here, the more VLDL, the higher your triglycerides, the worse, okay? Also, the higher insulin numbers, the higher blood sugar numbers, the worse. If all of those things are in conjunction, we need to look at fatty liver, non-alcoholic, or maybe from alcohol, fatty liver, and we need to begin to repair not just your diet, but the liver itself as well. And I've got lots of podcasts on that. So hopefully this was helpful. Again, this is something that I use with all of my private wellness clients. I wanted you to have the same access to these numbers that you can run. These are advanced blood lipid panels or chemistry panels for your cholesterol, but I find them to be extremely helpful, especially since heart disease is the #1 killer still in the United States, in the Western-based world. Very good to start knowing about this because it happens decades before heart disease or a heart attack ever set in. Take care, everybody. And if you want all of these as a list, head on over to stephencabral.com/3450. Have an amazing day. I'll be back tomorrow with a brand new Cabral Concept. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.